Welcome back to Diabetic Foot Files. Today, we're going to talk a little bit about radiation dermatitis. So, radiation medicine began in 1895 when William Conrad Röntgen discovered X-rays. Within months, physicians noticed skin burns in exposed patients. Then came Marie Curie, who isolated the radium and plutonium as showing that radiation could destroy tissue, including tumors. Early doctors unknowingly caused severe radiation ulcers before safety standards existed, and radiation injury has been a part of medicine from that day on. So, how does radiation work? The chemistry of it. Radiation therapy usually ionizes radiation, which has enough energy to remove the electrons from the atoms. So, what happens at the molecular level? Radiation hits water, which is what most tissue is made of, right? Most of our tissue is water. And the water molecules split, and that split causes the free radicals. Okay, it turns into like a O2 free radical. Now, these free radicals, they attack DNA, cell membranes, and proteins. And it also causes DNA damage, right? So DNA damage will will present itself in different ways. So one way that it would present itself is double-stranded breaks. Cells cannot divide. Rapidly dividing cells die, and the tumor as well, but also the skin. So what happens to the skin? So what happens to the skin cells? Radiation dermatitis is not a surface problem. It actually is a deep tissue biological injury. And we can't treat it the same way that we treat diabetic ulcers. It actually has to be treated a particular type of way. So what does it have effect on the certain type of cells? So let's say the keratinocytes. The radiation effect of that, it causes DNA damage. And the clinical outcome would be skin barrier failure. Then the basal stem cells, those are destroyed by radiation. So that causes a clinical outcome of delayed reepithelialization. Next is the endothelial cells. The radiation effect of that is apoptosis, and that clinical outcome presents itself as capillary loss. Next cell type is the fibroblasts. Radiation affects it by causing dysfunction, and the clinical outcome is fibrosis. And then next cell type is the lymphatics, and that usually happens a lot. And radiation effect is it damages the lymphatics, and the clinical outcome is edema and infection risk. So, what is the wound behind biology behind it? So, radiation causes three permanent problems. One, microvascular obliteration. So, capillaries disappear. The tissue becomes chronically ischemic. Next is fibrosis. So, the fibroblasts overproduce disorganized collagen. That results in a stiff, non elastic tissue. Next is stem cell loss. So the skin cannot regenerate properly. So this creates a hypoxic, fibrotic, poorly healing tissue. So why does this possibly, if you have diabetes as well, could make it worse? So as we already know, diabetes already has mostly a lot of patients who have diabetes have microvascular disease, have impaired leukocytes, have neuropathy, and have reduced oxygen delivery. So if a patient also has to go through radiation therapy as well, radiation stacks damage on top of the diabetic tissue, and most likely the patient risk of developing a chronic ulcer is high, very extreme high risk of having a development of a chronic ulcer. So how do you recognize radiation wounds? Clinical clues is the history of radiation in that area, geometric borders, fibrotic tissue, poor bleeding, delayed healing, and skin discoloration. Timeline, well, acute usually days to weeks, you would see redness and peeling. Subacute, which happens within weeks of having the radiation, you might have moist squamation. Next, chronic, which happens over months or years, you might develop an ulcer, possibly fibrosis or necrosis. And the fact of the matter is, radiation wounds can appear years later after they're finished. So that's fine, but it has to be educated that they're aware of what's going on. So, side effects. Side effects, like I said, chronic ulcers, osteoradial necrosis, where people need to be able to diagnose that properly, infection risk, delayed flap healing, and amputation risk, especially when it comes to the foot. So, treatment options. Therapy wise, there's layers of therapy for this. So, gentle wound care, the purpose is to help the fragile skin, moisture balance, that's the help support the barrier. Topical antimicrobials, that is to control the infection. Forgive me, it's a little late tonight. Hyperbaric oxygen therapy, that improves the oxygenation. And then surgical flaps, usually done in severe cases, but the key fact of the matter is be able to identify this because aggressive debridement early on will cause more ischemia. So avoid aggressive early debridement because why? Because the poor vascularity, the blood supply is pretty much destroyed. So what does modern research show? Radiation wounds show a reduced capillary density, a high level of TGF beta, which results in fibrosis, persistent inflammatory cytokines, impaired angiogenesis, and research supports oxygen therapy and surgical reconstruction when needed. So, what are some prevention strategies? Skin moisturization during radiation, gentle cleansing, avoid friction, tight glucose control, and early wound swirl. Okay, if you start noticing it. And the key thing is you have to remember if they have like a previous history of radiation, okay, if it's looking ischemic, fibrotic, things like that. So, what type of radiation is used in a therapeutic cancer treatment? Ionizing radiation. Radiation primarily damages cells by causing double-stranded DNA breaks. And free radicals are formed when radiation interacts with the water molecules in our tissues. And the most critical skin cell population that is depleted mostly by radiation is basal keratinocyte stem cells. And then you have to remember in tissue that has had radiation, they usually experience microvascular obliteration. And T transforming growth factor beta is heavily involved. This is a growth factor that's heavily involved with post radiation fibrosis. And as we know, it's quite hypoxic. So I hope this episode was helpful. It's a quick little summary about radiation dermatitis. And this is Dr. G with Diabetic Foot Files. Take care of your feet because we take care of you.